Necessarily those of this station, its staff, management, or sponsors.
Welcome to Let's Talk Hormones with Carolyn Zallmeyer. Take some time with me this evening to learn how to age healthier and live happier. Today we'll be discussing how hormones can affect all aspects of your health and well-being. I've been specializing in women's health and hormones for over 28 years and focusing in on bioidentical hormone therapy for both men and women for the past several years. We talk hormones, we don't talk sex, we talk health, aging, wellness, and relationships, and well, maybe a little bit of sex. So let's get this party started. Live streaming on Facebook tonight on the LowTE Florida page, live on 95.3 FM and 1470 AM here in South Florida, and also on the iHeartMedia radio app under WNN 1470. During the next 30 minutes, we'll have questions. If you have questions for me, you can call in to 1-888-565-1470, or you can send questions through Facebook. Tonight's topic is the benefits of bioidentical hormones and why it is so confusing, and we'll be answering questions on bioidentical hormones, so please call in or post your questions on the LowTE Facebook page, and we'll get to them. We have some questions that we've already gotten today through once we announced the program, so we'll be hitting on some of those too. So listen out for your name because we collected them. Tonight we'll be exploring bioidentical hormones. What are they? What are some of the benefits of aging with your hormones optimized? And answering questions. We're going to be taking questions again tonight in the next 30 minutes. So here's the number again. It's 1-888-565-1470. I've been providing hormone therapy for over 28 years and testosterone therapy for both men and women at LowTE Florida in Fort Lauderdale for over 6 years now. I've ranked number one in the state of Florida as the number one provider, and I'm ranking up there in the top two for in the United States, all in 2018. The response from my pellet patients has been nothing short of incredible. It's so nice that I get to give people hope and then actually make it happen. Both men and women produce estrogen and testosterone naturally, men mostly in their testes and women mostly in their ovaries. As we age, we produce less and less. Women can start decreasing their production as early as in their late 20s and men as in their early 30s. What you might notice as your hormones start to decline, it's hard to put your finger on it sometimes, but that fatigue, that's the number one reason why people come in to see me, is they just feel tired. They're tired of being tired. So if that's you, we may be able to help you. A lot of times you may be dozing off at the computer after lunch, or maybe feeling like you need a nap, or when you get home, you just don't feel like doing anything. That's a good sign that your hormones may need to be optimized. Mood swings, you're not just yourself anymore. You're a little cranky, you're saying things you shouldn't say, or you're not saying things you should say. Anxiety. I always thought that anxiety would reduce as we got older, but I'm seeing it with all my patients that the anxiety is increasing, and optimizing your hormones can actually bring that down. Tension and irritability, maybe things aren't going so well in the relationship or at work. A lot of times once we optimize our hormones, life is a lot easier and smoother. The lack of sleep, do you wake up at 3 or 4 o'clock in the morning and you can't get back to sleep? Maybe you're playing solitaire or words with friends at 3 in the morning. That's a sign that you're not getting a good, delicious 8 hours of sleep. Memory loss. Why did I go in the kitchen? Where are my keys? How about depression? Just not feeling as happy as you used to feel? I tell you, our hormones, our testosterone and estradiol, are happy hormones. They make you feel better, kind of give you the zip in your step back. Lack of focus. Maybe you're working on a project and your mind's drifting from here to there instead of focusing on your project. Or brain fog. You just feel like you're not firing as quick as you used to, that things are just a little cloudy and sluggish. A lot of times optimizing our hormones can help lift that brain fog. For women, a lot of times we hear about, traditionally with menopause, hot flashes during the day, where they get this fireball that comes from their feet all the way up. And on some pale ladies, you can actually see it, which is entertaining but not funny. Night sweats. Men and women, if their hormones are not optimized, may notice that they're sweating through their pajamas and onto their sheets, and that's not fun. So we can optimize that. That's just truly a low testosterone level. And weight gain, that's a second big one that brings people into my office, where they're gathering weight around their middle, not processing the food the way they used to. And they just want to look better and feel better. Joint pain. I have a lot of people that complain of arthritis, that knee joint pain, hip pain, and all that feel like it's relieved once their hormones are optimized. Migraines and severe headaches. A lot of times with the hormones, once it's optimized, you no longer have those severe headaches. Bladder symptoms. I had this one 72-year-old lady that came in, and she said the reason she got her pellet was really just so that she wouldn't have to go to the bathroom so often, and she felt like her mild urinary incontinence was relieved once her hormones were balanced. So it does affect those things. And decreased sex drive. As time goes on, sometimes your personal relations may become lower on the list of things to do for the day, or maybe you're trying to avoid it. A lot of times when we optimize your testosterone especially, you may get that loving feeling back, be able to want to have relations, and when you do have relations, things work better and you feel better and you get more satisfaction. So if any of those things are sounding familiar to you, we need to help you. We need to get your hormones optimized so that you can live your best life for whatever's left. What can we do to reverse these changes? At LowTE Florida, we use a BHRT method pellet system. The beauty of the pellet system is we can personalize a dose for your body utilizing your medical history and your lab values, and combine that together, and we can actually calculate it on the computer to find out exactly what your body is missing. What does it need? I insert the pellets, and no, it doesn't hurt. They're tiny little things, just like a grain of rice, that go under your skin on your backside, and they just, over the next 4 to 6 weeks, they'll just gently bring up your hormones and keep them steady so that you don't have the roller coaster effect of like a pill, shot, patch, whatever. And you'll start to notice different things after the pellet, and it can be as early as the next day. You may notice that your sleep is becoming a little bit deeper. You may feel your mood kind of lightens, and your sleep is just more delicious. And you may think of sex a little bit more. And when you do have sex, it's maybe the fireworks will be brighter and maybe you'll enjoy it a little bit more. So you just feel more like your old self, turning back the clock maybe 10, 15 years. Our population is aging fast, and we want to age healthier and live happier, avoiding over-medication through natural hormone optimization. So if you'd like a free book to learn a little bit more about it, written by the founder of BioTeam Medical, Dr. Gary Donovitz. Here, I've got one right here. I'm going to bring to the camera. Okay. He's my friend and mentor. Go to our website, LowTE Florida, and we'll send it out ASAP. The book's an easy read, fun, and very educational, and I think you'll enjoy it. I've had many patients bring it back into my office, and they will have dog ears, they'll have highlighters and little stickies on it with questions, and that's fabulous. I love to have the questions. That's why tonight we're opening up the phone lines and the Facebook to answer your questions about bioidentical hormone replacement therapy. But unfortunately, there's a lot of misinformation out there regarding hormone therapy. There's such a huge difference between synthetic hormones, such as Premarin, that my mother took back in the day and I used to prescribe, that's derived from pregnant mare's urine, and the bioidentical hormones that we're using these days. And I think of the differences like apples and oranges. They're so very different. They may sound the same, being a fruit, apples and oranges, and then hormones being bioidentical versus synthetic, but they're very, very different. Bioidentical hormones versus synthetic, what's the difference? The chemical molecular structure is different. And with bioidentical hormones, the chemical molecule in our pellets is exactly the same as what our body produces. The synthetic testosterone is like androgel, or the injectables have a different molecular structure, and they don't fit into the receptor sites in our cells throughout our body like bioidentical hormone replacement therapy. Ours, the bioidentical, fits into the cells throughout the body like a lock and key fashion. I picture the synthetic hormone kind of like you're trying to stick a square peg in a round hole. The bioidentical hormones in our pellets are used by over 3,000 BioT providers, is derived from wild yams. It's then processed into powdered testosterone and compacted into pellets at a 503B compounding pharmacy that has FDA oversight. One pellet out of every single batch that's created is sent to an independent lab, and it's tested 8 different ways for sterility, strength, compactedness, weight, etc. Any of that that does not fit the strict BHRT criteria is rejected and actually sold to others. So why should we optimize our hormones? We also call it the elixir of life, for the quality of life and good health. Many of my patients have noticed the following with testosterone therapy or bioidentical hormone therapy is an increased energy, vitality, and zest for life, improved feeling of overall well-being, and I keep hearing that over and over, depression relief, anxiety relief, improved thinking, cognitive clarity, improved memory, you'll remember why you went in the kitchen, improved focus, enhanced libido, sex drive, and enhanced sexual performance. Breast protection, we're finding that the studies are showing that if we can age with our hormones optimized, we have better breast protection, cardiovascular protection, increased bone strength. Testosterone actually helps rebuild bone. So if you have osteopenia or even osteoporosis, you need to be on testosterone to help strengthen your bones. Increase muscle strength. After 50, it's almost impossible to build muscle. So with the testosterone coming in, you can actually get your guns back. Reducing body fat, leaning out, looking better, and lowering your cholesterol. So why is menopause, andropause, male menopause treatment so controversial? We have a study that will, or an article that we'll go over in just a little bit, but we just had a question come in. Dawn, where is she from? From Boca Raton. She wants to know, can hormones help thyroid disease? Well, in our initial evaluation, we are looking at the thyroid in many different ways, and we want to know what is going on with the free-floating thyroid in your body, because that's what's going to make you feel good, give you your mental clarity, your energy, help give you your metabolism to work properly. So if you're trying to knock off a few pounds and you want to get your metabolism ramped up, we look at the thyroid and get it into a way that you can do that. So thyroid is a hormone, so it is part of our process because we've learned that if we can optimize not only the nutrients, but the thyroid, we'll get a far better result with our hormones. So that's the answer to your question, Dawn. If you'd like to learn more, come in to see me at LowTE, Florida. I'd be happy to go into it further with you. So there is this interesting blog by Beth Rosenshine from the Diamond Foundation. She wrote this fabulous article on wellness.com titled 5 Experts Who Are Wrong on Menopause. She writes, recently 5 menopause experts from different universities from the United States and Canada were all asked the following question: is hormone replacement therapy safe? And I get this question every single day. Their answers prove that they are no experts. Not one doctor acknowledges menopause as a disease. Oh, I have a call. Oh, my goodness. Okay, let's put them through. Kim. Hi, Kim.
Hello?
Hi, Kim.
How you doing?
I'm good. What's your question tonight?
Well, I'm 47 years old, and so I'm kind of thinking I might need some hormone help. Where do you get the pellets?
We actually get the pellets from one of the world's largest compounding pharmacies, and it's called Anazao Pharmacies. And there's one in Las Vegas, and we have one in Tampa. And they actually make the pellets there, along with a lot of other compounded things. And I've worked with them for over 5 years, and I've had very good success in that they are very, very careful with the way they're making the pellets. And since they're tested 8 different ways before we actually receive the pellets, we know and have the confidence that we have good quality pellets. And so where that's important is if I'm going to be adjusting your dose down the road, I know that what I gave you, 100 milligrams of testosterone, was exactly that. It wasn't 130, it wasn't 70. Because with big pharmaceutical medications, you can have that variance of 30% either way. And with our pellets, we know we have maybe a smidge of 3% one way or the other. So we do get them from a very respected pharmaceutical or compounding pharmacy. And what I like about it is that I've worked with other compounding pharmacies, and not necessarily for pellets, but for other things, and I've gotten recalls. And it's like, wait a minute, I already gave that patient the medication, but now it's being recalled. I've never once had a recall on my pellets. Not once. It's good quality stuff.
Wow, that's great. Do they get mailed to me, or do I pick it up, or how is it delivered?
Actually, some practitioners do have to do that where they write a prescription and then you have to wait for your pellets to be shipped to you and then you have to hand carry them in. But being one of the bigger providers in Florida, I'm able to have my pellets at the office we follow the FDA guidance or recommendations or rules to the T of having it locked twice and all this stuff and keep a good inventory. So we have them on site. So we're able to adjust your dose on that day. Because if you think about it, if they're sent to you and then you bring them in, and when we're talking, we realize, ooh, you would benefit from a little more of this or a little less of this, you don't have that flexibility. But with my office, you do have that flexibility.
So it's definitely best to go into your office.
Absolutely. Absolutely. Come on in, Kim. I'd love to meet you. I'd love to help you feel better and help you live your best life.
Thank you. Thank you so much. I appreciate the info.
Thanks, Kim. So, going back to that was fun, huh? Okay, call on in, people. Going back onto Beth's article, she was noticing that not one doctor acknowledged that menopause as a disease. By definition, a disease is defined by predictable signs and symptoms. The signs of menopause are predictable and universal. Loss of bone density, loss of body hair, loss of muscle tone, constipation, dry skin, shriveled genitals. It happens to every menopausal woman, whether she feels it or not. Not one doctor acknowledged that menopause is a disease or understanding of the basic human physiology. Menopause happens because organ failure, not because of human body loss or its need for hormones. Because if you think about it, our bodies are just not producing as much as they used to when we really felt well. So a person's body works the same way at age 105 as it does at 25. Our DNA and what fuels it, the hormones, vitamins, and minerals, never changes. This means our body needs the same thing at 105 as it does at 25 to stay healthy. This means the treatment should be lifelong. And I hear that from patients from time to time. How long do I have to do this? And my response is, as long as you want to feel well. Because you don't have to do it, number one, but you also don't have to feel well. But you have the options. We have choices. So real menopause experts would recognize a treatment is not forever, just not for a few years. Because traditional medicine right now, the goal is to give you the least amount of hormone for the shortest amount of time. And we know that we want to live a healthy life, a good life after 50. Who knows? It may be another 50 years. So not one of these doctors that she queried acknowledged that the organs failed, that the ovaries produce 4 hormones, not just 1 or 2, and the ovaries produce hormones that work together to keep a woman's body healthy, including the brain, the nervous system, skin, intestines, and muscles. Complete treatment of ovarian failure means complete hormone replacement, which includes progesterone, testosterone, and estradiol. Real menopause experts would recognize that complete menopausal treatments include all of the ovarian hormones, not just 1 or 2. So real menopause experts would recognize that the unethical hormone trials and dismiss the findings. Not one of these doctors suggested using bioidentical hormones. It's the fact that bioidentical hormones, which are maintained at normal youthful levels, can have little or few or no side effects. It's also a fact that synthetic or non-bioidentical hormones will always have side effects no matter what the blood levels are that they have. Side effects from synthetic hormones are always worse than those from bioidentical hormones. Bioidentical hormones like testosterone have been proven to prevent and enhance your breast cancer. Well, I don't like to say that. I like to say that it is supportive to the breasts. I'm not saying that it prevents breast cancer. While synthetic hormones have been shown to increase breast cancer. I was reading her study. Real menopause experts would understand that using synthetic hormones is like putting square tires on a car and expecting to have a smooth ride. It takes more than just having the term doctor or nurse practitioner after your name to become a menopause expert. As always, one should do his or her own research based on their specific symptoms and other health conditions they might need to consider. For example, how hormone therapy might not be the best solution for anyone who had breast cancer, ovarian cancer, endometrial cancer, blood clots in the legs, lung stroke, liver disease. But you should always be part of the conversation. We're going to take a short break and come back to answer your questions in just a moment. Many men and women are feeling tired, moody, having difficulty sleeping, gaining weight, and have no desire for intimacy or exercise. These symptoms can be caused by reduced levels of hormones that occur naturally as we age. You'll be happy to learn there's an exciting, safe, and natural solution available at LowTE Florida. If you'd like to learn more about how LowTE Florida can safely balance hormones for both men and women, call today or visit our website at lowteflorida.com. You've been listening to Let's Talk Hormones with Carolyn Zallmeyer. I hope I've made you feel comfortable enough to call in with your questions. The phone number is 888-565-1470. Now, let's get back to the show. Hi there, Carolyn here again with Let's Talk Hormones. I've got a question in from Bill from Delray. Is bioidentical testosterone covered by health insurance? I know when I use synthetic testosterone, it was covered. That really has to do with your insurance company. That's not really something I can answer, and you can ask them. We've had some patients that have had good success in being reimbursed for their therapy at my office. We can provide a super bill that has all the codes and the prices, and you can submit them. But we do not affiliate ourselves with any insurance companies, and it's basically a cash practice. So I don't know. Jody from Plantation, how often will I need treatment with the pellets? For women, it's 3 to 5 months, and it really depends on you, on your stress level, on your exercise level, what you do with your life. And for men, it's 5 to 7 months, and again, it has to do with their stress level and exercise. I've got some guys that really exercise hard that come in every 4 months, so it's just really different, and you'll know the difference because when your pellets start to wear out, you'll start to notice some of those good feelings that you notice will start to stop. You know, maybe your sleep will become more disrupted. Your mood may come down. You may not be thinking about sexual relations as much. So it's just different for everybody as to what they notice when their pellets come down, when they're wearing down. And then what we like you to do is to give us a call and we'll get you right in so that you don't go all the way back down. Jeff from Boca Raton, why do you say pellets are better than shots, the shots that I'm currently getting? Well, Jeff, what we've noticed is that with the shots, you're getting a big bolus of hormones. So your blood is spiking up with the testosterone. You feel fabulous, but then it starts to come down, and it comes down, and it comes down, and then you don't really feel so good. You may even get a little angry or cranky or whatever, and then you get your next shot. And so it's a roller coaster. You're going up and down, up and down. With our pellet system, we're bringing you up over the next 4 to 6 weeks and then holding you steady. So you don't have that roller coaster effect. Plus, you're not having to stick yourself once a week or once every 2 weeks with that large bore needle into your muscle with a very thick liquid that's like honey that hurts to go in. So a lot of guys don't like that. They don't like being stuck like that. So for men, it's very easy. They just come in once or twice, 2 or 3 times a year for their pellets, and it gives them a nice, even feeling. So that's why I say they're better. Sylvia from Fort Lauderdale, what are the side effects of your pellet therapy? That's a good one. Anytime you have a surgical procedure, there's always a potential for an infection. But for women, it depends on where we're at as far as your hormone levels. But some women may notice a little bit of breast tenderness or even some nipple tenderness. If you still have your uterus, you may have a little spotting as your body's getting used to the pellet system, but that's short-lived. Almost anything that you feel like that is usually done within 4 to 6 weeks after the pellet is inserted, and then you just get to feel really, really good. And that's usually only on the first pelleting. So Jackie from Pompano, how big are the pellets and where do you put these pellets? The pellets are tiny. They're like a little grain of rice, and they get inserted under your skin on your backside, like under your belt in your upper outer quadrant. And there's no need for a stitch, and it doesn't hurt. We use just little steri strips, gauze bandage with a clear bandage so you can shower, but no swimming, soaking, or hot tubs for 3 to 4 days after, and for men, 7 to 10 days after. So Elizabeth from Fort Lauderdale, I'm in my 70s. Is it too late to start bioidentical hormones? No, Elizabeth, it's not too late. You get to live your best life and feel really, really good. So any other questions come in tonight? No, we're good. I think we covered some good stuff. Anyway, thanks for all the great questions, and I hope tonight's show has helped you understand and become a little bit more comfortable with our bioidentical hormone therapy. If you would like to know more, please feel free to call my office, LowTE Florida, at 954-791-4498, or go to lowteflorida.com. I hope to see you in the office. Come see me. Next week's show, we're going to be talking more about hormones, and we'll review some of the research and provide maybe some real-life testimonials and experiences. Again, thank you for joining us, and we'll see you next week. Thank you for listening. It's my mission to help men and women live their best lives, and I hope that today's show gave you just a little motivation to do so. If you'd like to learn more about bioidentical hormones and if they're right for you, please call my office to schedule a consultation, 954-791-4498, or visit our website, lowteflorida.com. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily